The purpose of this short overview is to describe the purpose of the Family Connections practice model and a brief history of how it has evolved, highlight the philosophical principles that drive the intervention, and describe the core components and the process of work with families. Other videos provide information about the process of implementation, training, and fidelity. Family Connections is a multifaceted, home and community-based social work practice model that works with families to prevent child maltreatment and foster care. Staff use an intervention manual to reduce risk factors and strengthen protective factors. Family Connections was initially developed in 1996 through support from 2 federal demonstrations. In later years, further support was provided for replication of Family Connections across the country, and more recently, widespread implementation as a usual practice. 9 philosophical principles guide the way practitioners work with families. Thinking about the child in their family, in their neighborhood, and in society. We use empowerment principles, strength-based practice, culturally competent approaches, and outcome-driven service plans with SMART goals. There are 9 core components from intake to case closure, but the way we work with each family is individualized and tailored to their unique circumstances. At intake, we're assessing the goodness of fit of the family to what this program offers. Is this a family that without intervention is at risk of child maltreatment and potentially their children are at risk of out-of-home placement? Within 1 business day, we meet with the family in their home to help them understand what Family Connections is and how we work with families like theirs. We empower them to understand the options they have for accepting or declining this offer of help. From our first meeting with the family and throughout our intervention, we are continually assessing the capacity of the family to meet the concrete needs of their children. And we respond by supporting them to meet those needs before we move forward into change-focused intervention. We meet with all family members over the first month to understand their risk and protective factors so that later we can target those for our intervention. We use a computer-assisted interview that use standardized assessment instruments to help us clarify the targets of change. Based on the results of the family assessment, we select outcomes in collaboration with the family that then are translated into SMART goals to support them to make changes in the behaviors and conditions that led them to need our intervention. We provide individualized change strategies over 90 days in a focus of change-focused intervention, targeting the risk and protective factors that were underlying their plans. We formally evaluate change after 90 days by again implementing a computer-assisted interview with family members so that we can together examine the changes that have occurred over time and the risk and protective factors that were the focus of our work. If sufficient change was observed during the evaluation of change, then we move to case closure and help the family celebrate success. If there are still continuing issues that require our intervention, we renegotiate a plan with the family that targets new or the same risk and protective factors. Staff receive at least an hour of supervision and coaching individually each week, and as a team, there's group supervision at least for an hour, again using the coach approach to support staff to critically learn and grow. Action for Child Protection, a national nonprofit, staff and consultants provide training, technical assistance, and implementation support. Programs sometimes also sign up for individual coaching for their supervisors. Please let us know if we can answer other questions.